Hi, everyone. Welcome to the podcast of the Cleft Palate Craniofacial Journal. I'm Pat Chibbaro here in New York. I hope everyone's well. And for all of you on the Northeast, I hope you are digging out of this crazy, crazy snow. So, uh, and I have to say, this has been a podcast that we wanted to do. We've had some technical issues, but we persisted. And so we are back to, I want to share a very important paper that has 16 authors, and I'm not going to read them all. So when I see you all at the ACPA meeting in Boston, nobody yell at me that I didn't mention you, but you're all here. All the authors are here. And so this is a great paper. A lot of my wonderful ACPA colleagues are on this paper. Everyone should read it. And I think that you're presenting this right? You're going to present this at the ACPA meeting. So after you listen to this podcast, if you have more questions, make sure you come to Boston and ask the authors. They will be there. So this paper, which is OnlineFirst in December of last year, Ethical Considerations for Clinical Data Sharing in Craniofacial Research, Recommendations from a Multidisciplinary Working Group. And two of the authors are here with me, Stephanie Kraft and Carrie Heike. And it is, and I won't say from where everyone is because they're from all over the place, all over the world. I see people internationally. So I'd love to welcome both of you and kick off this this paper. It's really great, and I look forward to talking to you about it. So thanks for joining me.
Thank you for having us.
Yeah.
So this is a big, big effort, and I know that you've all worked together, or many of you have worked together for many years on many different projects. And so maybe if you could sort of tell us why you got together to do this, and then let's maybe get into sort of and it's interesting, you had 16 authors, and I think you had sort of 16 outcomes, something like that, right? So Carrie, why don't you start us off with this?
Sure, yeah. So I'll step back for a minute and take kind of the bigger perspective that led us to this work. So I'm a pediatrician. I work on a craniofacial team, and I'm also fortunate to do clinical research. And one of the things that we know is that in all areas of healthcare, there are opportunities for improvement. And so I have had the chance now to work for many years with interdisciplinary teams across the country, proud member of the American Cleft Palate Craniofacial Association, and working with people who are really dedicated to this interdisciplinary team care. And what we know are there are just a number of unanswered questions about how to optimize that care. And so, again, have been fortunate to have been supported by the National Institute of Dental and Craniofacial Research to tackle some of the questions, a small fraction of all of the questions we need to address, because we know that clinical research is the way to really generate the evidence that we need to change and improve care. And so for each research study that we run, we follow a very strict protocol with regard to how we're engaging potential participants. And there's a very clear guidelines on how you approach participants, making sure the study is a good fit for them, being able to walk through the details of why the study is being performed, what will happen during the study, how their data will be used. And for each specific study, then we go through that process. What has become clear is we haven't had the opportunity to ask the bigger questions beyond this specific study. How do you want your data to be used? What things should we consider in this new era in which we want to make sure that your participation and the data that you provide is really used to its maximum potential, so that we're not maybe just answering the question that this study was designed to do, but we're also using that information when it's appropriate to answer other clinical questions. And so that's where Stephanie Kraft comes in with her expertise. And maybe Stephanie, do you want to speak a little bit to what's happening on the NIH landscape with regard to data sharing?
Sure, yeah. So I'm a bioethics researcher, and my focus is on research ethics. And so I'm often finding myself partnering with clinical researchers like Carrie and others on her team to try to navigate these challenging ethical questions. Data sharing, of course, is one of those questions, and it's increasingly tricky, I think, because on the one hand, like Carrie said, it's so important as a tool to expand the impact of our scientific research and ultimately help more patients, right? That's the end goal that we're all kind of working toward. And policies like the NIH policy on data sharing and policies from other research sponsors are increasingly encouraging broader data sharing and really embracing the principles of open science. And that has a lot of potential benefits. The challenge, though, is that there are also very real questions and concerns that participants and their communities might have about what happens to their data after they, after they're outside of the original research team, right? So a participant might have an initial trusting relationship with that original research team, but then how does that transfer beyond that original study? What does it mean to be trustworthy when we're managing people's data as they move beyond the original team into a database and then are used for potential future research? And unfortunately, there are examples of research data being misused in ways that can cause harm to communities. And so we need to be really thoughtful about how we govern, what kind of governance processes and procedures we have in place to make sure that we're preventing those harms and also maximizing benefits for people who did contribute their data and want them to be used to advance science. So trying to find that balance.
As the nurse practitioner on the team, I'm often the one that the researchers come to, to get the data because we, on that front line with the patients know them. And, as you're talking, I'm thinking about the years of trying to, quote, convince the patients and families that it's safe for, it's to participate in this study, that, but sometimes I guess I used to feel that I didn't have the language. I'm not sure how to put this, but I don't know if I did always a great job. I did the best I could to try to reassure them, that their data that things would be protected. So, that's why I was really, when I saw this paper, it really sort of brought back all of those thoughts. And I wonder, like, what motivated, was there some kind of motivation for your group to come up with these recommendations, or to, I don't know. It's just something that I was just thinking about as you were talking, Stephanie, about, trying to make, because I used to think that, the researchers would do so much work on getting this ready and having a great question, something that they really wanted to study that could benefit the care of a patient or, support the family. And, all the work they put in, and then they would come to me and I am ready to try to help recruit patients for them. And just sometimes I felt that I wasn't, able to sort of, and I know the ends are so important, right? If you don't have the numbers and the data isn't, may not, really be scientific enough. And so I'm glad to see this, so maybe we can talk more about, sort of the road that you took to get here.
Well, can I just speak really quickly to your point? Because it's reminded me, it's been years of motivation to get to this place, and I am so thrilled that we were able to do this work. And to your point, I think my perspective, especially as an early investigator, was on privacy and, making sure that people felt really confident that their data would not be misused, that, as Stephanie said, it's so important to have that trust.
Yep.
The challenge then is, people really invest a lot of their time in contributing this information to the study, and if it is possible to answer other questions, it would be ideal. And now that we have more incentive to do data sharing, it's much easier to do data sharing. There are a lot of people that want to, again, kind of generate evidence to support better clinical care. It raises new questions about, who's making the decisions about that data. So I might technically have permission to share it based on the language and the consent, but I don't know beyond what I consented them for how this participant really wanted their data used in the long term. And we have to think 5 years ahead, 10 years ahead, 20 years ahead, because we really want to be clear on the, what could happen, what could be done with this information. And so to your point, what felt funny to me as an investigator is that people would come to me and say, well, could we use this data set for X? And I felt like I could answer that question technically based on permission levels, but I don't have the confidence in what the craniofacial community wants. Right. And we need to go back to the community and find out their wishes before we start figuring out the details and logistics of how to do this work. So it felt like a critical step where we need to go back to the community and really start to engage them more meaningfully in making these decisions and leading these discussions instead of it being led by investigative teams.
You know, it's so interesting because I'm thinking now, as I was looking at the ACPA meeting and the program, there's so much more involvement of those in the craniofacial community, both those who are maybe members of different organizations or nonprofit groups, or also a lot of those who are have a craniofacial difference and are now part of craniofacial teams.
Yes.
So I'm wondering, you know, how is that, you know, affecting, you know, in a good way, hopefully, how is that helping that conversation that you just, to your point, that you just mentioned about, you know, getting the involvement? What do they want? You know, because I know, you know, that talking to parents over the years, they want to help. They want to be able to share information that, or, you know, let information about their child be shared, but they do, you know, there is that privacy issue and that trust. So I think that the more that, you know, that's what you're doing here is going to hopefully help support more families wanting to, you know, wanting to participate. So, and the other thing I'm thinking about as I'm reading this is I feel like now every time I read something or just in my clinical practice over the years, it became, no, something has to be evidence-based. Whatever you're doing has to be evidence-based, and that is the push, you know, which then is push for more research. And so more than, you know, then this is so, you know, this is so important. So, but no, so it's, you know, and I think it'll be great at the meeting to be able to have those in the community, you know, talk with you, with you, and I'm sure a lot of the other authors will be there just about, you know, I'm sure some of them have participated in research, you know, and about them, you know, about the care that they got. So I just think it's I'm seeing so much over the years, and because I did this for so many years, going from where everyone was sort of just doing their own thing, you know, and to everything being based on research, which then, you know, there's so much, as you said at the very beginning, there's still so many questions to answer. Anyway, so
I was just going to kind of build on that. I mean, I think one of the strengths of our process was that, you know, everyone in our working group was coming with a different professional background, lived experience, different perspectives, but there was this shared alignment on the importance of centering participant and family and community experiences. And I think it's that, like, that was the piece that allowed us to really get into the details of how do you operationalize this and have really productive conversations, because we all kind of started at that same point of really trying to center the, you know, participant and family experience.
So maybe, Pat, I can set the stage to how we got to this point, and then let Stephanie walk us through how she approached it. So because we had the good fortune of having a NIH grant, which I can't overestimate the importance of how important it is to have support and funding to do this kind of work. So we were grateful already to be conducting a study focused specifically on optimizing care for children with craniofacial microsomia. And again, very critical to this, the NIDCR at the time had opportunities for what they called ethics supplements to allow research teams to investigate questions that were maybe outside of the scope of the original project, but related to the project. And because I had had the good fortune of working with Stephanie in the past and knew her skill set, it seemed like a phenomenal opportunity for us to answer some of these bigger questions that we had that were outside of the specific goals of that particular project. And so we turned to her for her expertise in how does one go from where we are, where we have all these unanswered questions about data sharing, to designing a study so that we can actually meaningfully come up with a set of recommendations that were generated in this report. So maybe I'll turn it over to Stephanie with regard to how she approached that problem.
Yeah, I mean, you know, when you know, Carrie and I first connected about this, I was really excited because it was, as I said before, I think this is a really important issue, and this was a really great opportunity to bring together, you know, people's actual participant experiences through the qualitative interviews that we did, and bring together all the different perspectives in our working group and try to sit down together and work through these tricky questions of, what are the key areas that we need to be paying attention to, and how do we find that balance between moving science forward and also doing it responsibly. So yeah, I mean, I was excited to get started and to kind of dive in and partner with her team. I think so much of the structure that her team had already set up made this really a really productive collaboration. And so I really enjoyed working with the entire group during that process. And then as we kind of entered the working group process, making sure that we had a wide variety of different perspectives to come to the table, that was a really important component, of course. And I think even as we went through, I'll acknowledge there were some perspectives that came up that we kind of realized that, we maybe need a little bit more expertise to really flesh out some of these recommendations. For example, some recommendations around how data are used. I think data science expertise could probably flesh those out a little bit more. There were some questions about AI, and I think we could also further expand on those. So I think we took a really thoughtful process to get to where we were, and then also identified some areas that we can expand to moving forward.
So then how did you logistically do this? You have people from all over, and you met in person, you did, how long of a process was this for you to come to be able to produce this work?
Yeah, so we did a lot of preliminary work. Our working group met twice virtually to introduce everybody to the project. We shared our empirical findings from our previous interviews that we had completed and kind of set the stage for the types of issues we were going to be addressing. And then we had one all-day meeting, primarily in person. We had a little bit of remote attendance as well for those who couldn't make it, and sat all day, and we used team science principles to guide our agenda and tried to deliberate about different topics, and through that process came up with our draft list of recommendations, and then we went through a bunch more iterative review asynchronously after that until we finally got to our final set of recommendations. I'd have to think how long that took. It
was a day. Oh, you mean the whole process?
The whole process.
Yeah, I mean, I think to your point, Pat, for me, it was almost overwhelming to figure out how you would actually go about this. So I was really grateful for Stephanie's scientific expertise in this area. And she speaks to the preliminary work, and we have a publication on that as well. But doing those foundational interviews was really critical to get rich qualitative data informed by people that would be most impacted by the decisions in the recommendations. And she did a phenomenal amount of work in advance of engaging this group because we all have different backgrounds and different levels of understanding of the complexity of the issues that we're talking about. It takes a while, including for me, to think about all of the considerations that go into data sharing. And you can imagine too, what might be very intuitive to me as a researcher and what I mean about even just data sharing, we have to really break it down so that everyone is well informed about what we're talking about. And then, just the number of complex issues we're talking about, people with relatively rare conditions.
Yes.
We're talking about photographs. We're talking about, genetic data. We're talking about parents consenting on behalf of their children who are going to grow up and become adults, and what happens over time to that consent process. When do we make that transition and how do we then make sure, if we do believe that they should be recontacted to to state their preferences as an adult, how do you do that? How can you guarantee that you'll be able to do that, right? And how do you do it in a respectable way, so someone's not getting a phone call at college about a research study that they didn't know they had participated in 20 years ago. Yeah.
Exactly. Yeah. I mean, and that is, I think, and I wonder what were what were the greatest challenges that your group faced in doing this work because of the logistics, the number of people involved, different perspectives. I wonder, were there things that, as you think back on it, you thought were challenges, or were there things that you didn't expect to find in this, or any surprises, anything to share with us?
I'm sure Stephanie has things. I guess for me, I feel like it was such a good experience in just scratching the surface. So I think the challenge we always have with every research project is that we can't address all of the important issues. And so we do have to focus on, making sure that we come out with some set of recommendations that everyone feels comfortable with. So, and just want to have that caveat that this is hopefully the beginning of many efforts in this area. We had this great opportunity with this specific project, but it really is, I hope, the first of many larger conversations about this topic, and not meant to be definitive by any stretch, but again, going from a place where there wasn't any guidance to having some kind of evidence-based guidance, and then taking it again to the next levels in order to really be able to put that into action. And although we focus specifically on a population for kids and adults with craniofacial microsomia, it's not, these set of recommendations, again, are just preliminary even for that group, but a lot of them are broadly representative of individuals with cleft and craniofacial conditions too. So I'm hopeful, and with Stephanie's guidance, we can continue this work and broaden it and make it a little bit more robust for implementation as policies and additional funding opportunities and research hopefully continues to gain momentum to answer some of these questions.
Yes, I was going to ask, so what is the next step with these recommendations? And what I think about is the medical students who come to me, or the residents who are doing, starting to do research, who come to me and are, asking for help with their project or in recruiting patients. And will this be something, or is it your vision that these recommendations will be something that will be known, like sort of generally known, that new researchers will be looking to for guidance, or that their teachers will be guiding them towards looking at recommendations like this as part of doing their research?
I would hope so. I mean, I think what's nice about the way that we ended up, what's nice about our recommendations is that they're tailored. We have a table in our paper where it kind of points to different people who can implement them, or different organizations who can implement them at different stages. So, some of them are designed for data repositories and thinking about how, if you are a data repository, how you govern data in that setting. Others are things that an individual researcher can be doing, and you don't have to do all of them at once. I mean, we ideally all of them happen, but even an individual can say, okay, I'm going to focus on, a medical student researcher might say, I'm not doing a project yet, but I really want to be responsible when I do start to do this work. And so I'm going to take some time to really understand, what are the types of concerns people have, what are the things people hope that will happen with their data, and use that to inform how they move forward. And I think that in and of itself can be a really helpful step. So I think lots of people kind of at all stages along the research pipeline can find something that they can take action on themselves, even if it's not all at once.
Right. So is this group continuing the work on this? Everyone in this, on this project? Are you, is there another step to it, or do you need more funding to be able to do?
We need more funding. Yeah. No, I mean, again, like I said, because it does take a lot of infrastructure and support to be able to do this rigorously. That's our hope and our goal. And I think, like you said, there's a lot of good momentum in the craniofacial community to get more community involvement in research. And that's been done very well in other areas. So I think the potential is great for us to do that more meaningfully, but it does take some degree of support for all of the participants in this kind of work. And so that is something that, again, we're so grateful to NIDCR for funding this, for seeing the vision of the need to address these important questions. And we've brought back the results of this study to the leaders in the Institute, and are looking for other opportunities to engage the community more meaningfully in this type of work. And so that would be the goal, is that, this is now publicly available, and wanting to get some feedback on how it's received from the community, and then what are the next natural extensions of this work to get to the place where we feel like these kind of principles and guiding considerations for research are more accessible, well understood in the community.
Well, I
Yeah,
look
I
forward.
think there.
Oh, go ahead.
I was just going to add. I think there are a lot of ethical questions that come up, and this type of interdisciplinary collaboration that we were able to have in this project, I think, was so valuable. I mean, for me personally, I really valued getting to, just learn more about craniofacial microsomia and about all the work that Carrie and her team are doing. I've gotten to attend the ACPA conference once, and now I'll be back in Boston in next month. And it's just been really valuable for me as a bioethics researcher who thinks about research ethics issues to really engage on the ground. And I hope that our work is impacting things for participants and their families too. And so just to acknowledge that there, I think, are lots of opportunities. This won't be the last ethical issue to come up in research. And so there are certainly, I think, many opportunities to continue this kind of work in the future.
Yeah, and definitely, especially now we have so many engaged members of the community who are adults now, and there's just so much, and we've seen a lot. I've done podcasts on papers interviewing adults, and it's really quite fascinating and really interesting and so helpful in terms of what are we missing as in terms of it's always been about comprehensive care, right? It's always, I've always said to families, it's not just about the surgery. There's so many issues that patients and families with craniofacial conditions deal with it, and there's so much to study to be able to deliver better care. And so that's why I'm really excited to see so much of the voices now. You're hearing so much of the voices of those adults. And so definitely, and you'll see at the meeting, and I was looking there, there's just so much more involvement of them, panels with them, and just so much. And I know there's one panel of craniofacial team members who have lived experience, and so be interesting to see what research even comes from them themselves. There's just so much, and so why I think then that these recommendations are important, because there's just more and more data which is good, that is coming out now. So I'm really excited to see this presentation, and and it'll be great because there will be in the audience, I'm sure, many of those who are in the community, who, maybe have participated, maybe their parents had participated in studies that they weren't even aware of. I think it's it brings a lot of discussion and a lot more questions, and the more input, I think, too, that you can get from the patients, the better in terms of the research itself. So I think, so just one more question before we wrap up, which is, so you said that, so these recommendations are publicly available. So is there a place that, so say a medical student is coming and wanting to do research and has, questions about how to, what the study is going to be about, what questions are going to be, privacy, all those issues. Where do you direct them to besides, them going to this paper, certainly, but is it going to be located somewhere for them to see?
It's such a good question. So that is one of the challenges we face, right? In our community, is where's the single kind of place to go for fundamental questions like this. So if you were savvy enough to know how to do a PubMed search on the specific topic, then of course you would find it. Hopefully people are reading CPCJ regularly, and so they get those access to the content and are aware of these things. But the reality is, as you pointed out earlier, it's hard for a new investigator to come into a new research question or topic area and understand everything there is to need to know before launching into that. So I would be highly impressed or surprised if someone were able to find this paper because they're starting a new research project and they wanted to think about how their data is being used. So back to that point, I think, again, I always look to the American Cleft Palate Craniofacial Association as being the hub of information for this kind of work. And I know that they are incredibly dedicated to building out their research resources for people. And so my hope is that we get to a place where that is the go-to place to find this kind of information. And then certainly for the participants in our studies, we have research websites that we will post this kind of information on. But again, that's very nuanced and hard to find. And so again, wanting to direct people back to ACPA for guidance on this kind of work.
Definitely. And I have an idea for you. You can do a webinar on this. Carrie, I'm the queen of webinar. I just did a webinar for ACPA, and I just did one on preparing kids for surgery. Anything that we can get out there that can, and so I see you guys doing a webinar about this, and then it goes into the archives of the ACPA, and anybody, so you got all those medical students and residents, and then that's just another resource. So I'm just throwing that out for you.
Thank you for that.
Not that you don't have enough work to do.
Well, but as you said, it's critical because it's almost overwhelming how complex it is to launch a study and to feel confident that you're doing it in a rigorous way that's respectful and meeting the highest standards. So we'll bring this back to the ACPA research day again, get their thoughts on how we might promote some of these standards.
Well, as an ACPA member, I could always send in my suggestions on my evaluation. Put that presentation into a webinar, please. So, well, I knew this would be a great conversation. And I'm really so happy that, that you guys took, first, I'm happy you got funding. Wow. Kudos.
Yes,
but
thank you.
And so to produce this work. So for everyone that's listening, definitely you want to read this paper, and when you go to the meeting, definitely go to this talk. So OnlineFirst in the Cleft Palate Craniofacial Journal in December of last year, you will see ethical considerations for clinical data sharing in craniofacial research, recommendations from a multidisciplinary working group. There are 16 authors, and to all of my friends who are authors on this paper, you're on here. If I read it all, it will take forever. It's amazing. It's a group from all over the country. And Stephanie Kraft and Carrie Heike are two of the authors here with me. This is a must read especially for anyone involved in research on any level of it. And I'm just really, really happy to see this paper. Look forward to seeing you both in Boston in a couple of weeks. Carrie, you're coming to our side, right? Stephanie, you're in DC. Are you in DC?
I work in Pennsylvania. I'm based in New Jersey.
All right. So you're coming to our side of town.
Yes.
So dress warmly.
Yes.
Thank you so much for joining me.
Thank you.
Thank you.